There is a growing problem in Texas. Hardworking Texans are losing their jobs contingent on taking an investigational vaccine.
My name is Jennifer Bridges. I am the registered nurse here in Houston, Texas that was fired back in June from Houston Methodist System for refusing to take the COVID shot by their mandate. I was amongst a group of hundreds that were the first ones in the nation to have this mandate and be forced into being terminated from our jobs. This is very unjust, unethical, and unconstitutional. We are here making sure that this does not happen to so many other people across the country. Unfortunately, it's spreading not only between healthcare workers, but every other walks of life, every other business out there.
We have too many elected officials who seem to have forgotten that the primary purpose of government is to protect individual liberty. Many individuals across our state and nation are facing a devastating choice, whether to take a vaccine they do not want or leave their jobs, forfeiting their means to provide financially for themselves and their families. No modern-day American regulation has ever required a person to undergo a high-risk, irreversible, possible life-changing and life-threatening medical procedure just to be able to feed their family. There is a growing push for mandated vaccines for COVID-19. My office has heard from many people throughout Texas who are being required to get the COVID vaccine in order to keep their job. The mere fact that a person has not received a specific vaccine or vaccine does not make them a threat to others. It is also wrong to ignore the well-established fact that natural immunity is far greater and longer lasting. As of September 24th, the FDA's Vaccine Adverse Events Reporting System, or VAERS, contained almost 16,000 cases in which COVID-19 resulted in the patient's death, and it contains almost 800,000 cases of serious adverse reactions. Recently, a whistleblower provided some CMS data, that's the Medicare information, showing that well over 45,000 Medicaid recipients this year have died within 14 days of receiving the COVID-19 vaccine. To provide some perspective, in 1976, 45 million were vaccinated for swine flu. A mere 53 people died, and the program was immediately terminated and the vaccine taken off the market.
Governments are instituted to preserve these rights. Our rights do not come from government, they come from God. These rights that we have from God should not and cannot be infringed by government, nor by private employers. The state of Texas has a responsibility to push back on the federal government and has a responsibility to rein in these employers.
This is about letting people making their own decisions for themselves. You know, I trust my fellow Texans to make their own choices regarding vaccination policies, whether they should get one or not. We shouldn't decide for them. And, you know, frankly, no one should have their livelihoods threatened and their ability to feed their family threatened for their sincerely held beliefs or medical beliefs regarding a COVID vaccine.
It's in these times when you do have the emergencies that the Constitution matters. You know, when everything's going okay, maybe you don't need the Constitution, but it matters now. This is why we have the Constitution. I'll just add with this. You just think of just the hypocrisy and the dichotomy of this. No pun intended. We're just olaying people through the border. No COVID tests, no stopping them, monitoring their health conditions like they want to do with you, no stopping and wanting to inject them with vaccines. They're just being olayed through.
Don't you find it a little odd that hardworking, tax-paying Americans are being forced to take a shot while those unemployed and government services aren't? It's an odd thing. For the past few years, we've seen tyranny expand in ways that many of us could not have imagined. People across the political spectrum view forced medical treatment as tyranny. People who've never seen or say they've never been concerned with politics before are now concerned. Putting people in a position of choosing a shot between their livelihoods, their careers, their ability to participate in society freely, to go anywhere that they want, to get an education, is an immoral restraint on our God-given liberty.
We're in the days where we have to respond and we have to be bold. We have to be bold. We have to stand up to the federal government, just like my colleagues has mentioned. I've had people call and tell me they're losing their job because they're refusing to take a vaccine for whatever reason. And if we allow this to take place, how in the world can we say we live in a free society when people are losing their jobs because they chose not to take a vaccine for religious reasons?
People should have medical choice. If a medical provider is taking government money in the form of Medicaid, they cannot refuse to take a patient simply based on the fact that they are not, in that doctor's opinion, up to date on their vaccines. We see too many people who are being kicked out of having primary care physicians over and over again. They're refused in primary care practices because they don't want their child to take vaccines at the exact moment when that doctor wants it.
Ultimately, even if there were no adverse reactions, it's about personal choice. And I think ultimately, when it comes to any medical decision, that should be between the individual and the doctor, and giving them the freedom to get a vaccine or not get a vaccine, whatever their doctor says. Government has no role to play in that.
One of the problems that we're having in healthcare right now is both nursing and physician shortages. That's for several reasons. Most people are burnt out. I had a lady, who's actually not my patient, but I'm in a position to help with regional health care. It was in a hospital north of us, a rural hospital north of us. She was 24 weeks pregnant and actually getting pretty sick and needed to be transferred to a high level of care. With the assistance of our director, we called pretty much everybody in the state. It took us 4 days to get her a bed out of there, and by the time we got her transferred, she transferred down to Clear Lake. She was intubated, the baby decompensated. They delivered the baby, and then she decompensated, and they had to transfer her to another facility that had ECMO, which she needed at the time, all because, not necessarily of hospital room shortages, but staff. All the numbers that you're seeing they're saying they're only 1% of their working staff that are being dismissed, that's going to add up in a hurry. And if you think we have a healthcare provider shortage now, I think it's just going to get worse.
At recent count, I had on my paper 22 bills. A few more have popped up, 24. We've heard of more being filed that are dealing with vaccine mandates in the state of Texas in the third special session only. That's besides the more than 24 bills that were filed in regular session and some of the others in special session. You know, it is highly disturbing that so many legislators have been responding to their constituents who are calling them saying that their jobs are threatened, and yet these bills are not moving in this special session. Most of these bills have not been assigned to a committee. They've not been scheduled for a hearing, and we are limited where the call for the special session is limited to explore the question on whether or not the government can mandate vaccines. You've heard we need the governor to add this to the special session to the call. all. We also need leadership in the House and the Senate to allow and help support these bills move forward. Texas, the citizens of Texas deserve to have our elected representatives debate these bills on the merit and talk about them. Squashing them at the outset and not even giving them a chance, that's not acceptable. These brave men and women who have filed and co-sponsored these bills deserve to have the bills heard, and the people deserve to be here in the Capitol to testify and make our voices be heard.
Informed consent and medical freedom are basic rights Americans are supposed to have. That includes the right to consent or not consent to vaccination after discussing the risks and the potential benefits in your own physical and biological situation. Life without liberty allows no pursuit of happiness. And when our government decides every individual must have a certain medical treatment without any regard whatsoever for the degree of personal risks of life, such a treatment poses for that person, along with no consideration whatsoever for the confirmed science that says recovery from COVID provides at least as much protection as a vaccination. Then it is a government that is cold, heartless, uncaring, and has no business being entrusted with the lives it treats so callously. The same people who are mandating vaccinations are not even bothering to provide insurance or funds to cover deaths or damages that may result from such a vaccination. Such callous decisions with a callous disregard of the danger to an individual employee are now causing a shortage of nurses and healthcare workers. Regardless of the conflicting information or misinformation coming from governmental sources, these healthcare workers have seen adverse reactions from vaccinations or a lack of help in specific cases. And they do not want to be an actual casualty to political correctness nor to unmitigated greed. Last I checked, this is still Texas and this is still the United States of America, and nobody should be coerced, bribed, threatened, bullied, lose their jobs over not taking something that they're not comfortable with. And I was in that hospital for well over a year treating COVID patients. I've seen the adverse reactions that vaccine can do to you. It is not even proving to be effective. People are out of their jobs all the time on leave because they are vaccinated. I beg everybody call Governor Abbott and tell him to put this into special session, put this into the call. We need to pass these bills. We need to protect people. I beg Governor Abbott to please help these fellow Texans. Nobody should have to go through this. Thank you.